Okay, hi Judith. Just gonna start off by scanning the room. There's nothing here. It's just a very messy room. Nothing in the corridor either. Okay, so before we start now, is it okay? Okay. So I'm a nursing student. My name is Gerald, Jerieellegaspi. I'll be doing the head-to-toe assessment for you on video today. It's playing, recording right? Yeah, it is. Okay, so I'm gonna start by doing hand hygiene. We're not wearing shoes, but I am in uniform. Okay, wipe the stethoscope as well. I don't have a thumb depressor, but I'll be using the handle of the spoon for when I do the mouth assessment. So I'm coming in now, knock on the door. Okay, hi, my name is Gerald Gaspi. I'm a nursing student at Seneca. Is it okay if I do a head-to-toe assessment on you today?
Sure.
The head-to-toe assessment that I'll be doing is because I need to pass my course. Do you need to use the bathroom?
No, I just did.
Do you feel safe? Are you comfortable?
Yeah, I'm okay.
Okay, thank you. So looking at the patient today, his chart says he's 35, but he looks much younger than he is. He looks younger. There's no odor coming from him, and his facial expression shows that he's tired. We've been at this for some time now. His dress is okay for the weather. He has good personal hygiene. Good weather, and he doesn't look malnourished. He doesn't look malnourished or overnourished. So his nutrition is okay. There's no signs of physical deformities, and his body is symmetrical, and his height is okay for his cultural background. And okay, so can you please walk 2 steps forward and 2 steps back, please? And walk back. Okay. So as he's walking, there's no signs of distress. He's not stumbling. He's not having any problems with walking. Everything is good in relation to his plumb line. As I'm talking to him, there's no problems in his speech. His speech is okay. It's not slurred, and as he was walking and as he's sitting down now, he's not having problems breathing. His breathing is not labored. He's not using accessory muscles. So, do you know where you are?
Yes.
What's your name?
In my room. Yeah, Randy.
Okay, do you know what time of day it is? Morning or night?
It's morning. Morning?
Yeah, it's well after midnight now. Okay, so now I'll be starting off with the head examination. So looking at, just observing the head, it's normocephalic. There's no masses or lesions or bumps. His hair is also very clean. There's even hair distribution. He has very good personal hygiene, even hair distribution. The hair is very soft and thin. No foreign bodies in the hair either. Normocephalic head. Now I'll be looking at the face. As I'm touching the face, there's no involuntary muscle movement. There's no odd discoloration, and there's no signs of edema either. No signs of edema, and no odd discoloration. No masses or lesions And now, can you please do some facial exercises with me? Can you please smile, frown? Okay. Show your teeth. Close your eyes slightly. Raise your eyebrows. Puff out your cheeks. Okay. And as he does this, everything is done symmetrically and with no problem or lagging. As I touch his cheeks, they don't collapse, so we can see the facial nerve is intact. He's able to do it all. And now I'm going to be looking at the ears. Looking at the ears, there's no discharge. They're both equal level bilaterally, symmetrically, and there's no mounds of cerumen protruding from his ears. Is there any tenderness as I touch your ear?
No.
And no tenderness in the auricle? No tenderness in the trachea? No tenderness?
No.
Okay. So I'll be whispering 3 words into your ear. Can you please press this bone over here as I whisper the 3 words and repeat them back to me? Okay. Judith. Belt.
Apple.
Okay. Now next one, please. iPad. Remote.
Lampshade.
He's able to repeat all 3 words, all 6 words as I said them to him. So trochlear nerve is intact. And now I'll be looking at the nose, his nares. Okay, looking at the nares, there's no crusting or discharge. So there's no crusting or discharge around the nares. I'll be touching as I touch your forehead, the frontal lobe. Please let me know if there's any pain.
Sure.
Any pain?
No.
The maxillary lobe, no.
No.
The maxillary sinus and frontal sinus, they're both, there's no pain, only mild pressure. So we can say that his sinuses are clear. and not inflamed. Now I'm going to be looking at the eyes. Looking at the eyes over here. There's no crusting or discharge. The eyelashes and eyebrows are both there, even hair distribution. The sclera is a nice pearly white, where the conjunctiva over here is a nice moist brown. There's no, like I said, there's no signs of ptosis or lid lag as he's breathing, as he's blinking. I'm going to be looking at the pupils now. Looking at the pupils, they're a nice 3 millimeters, which is regular, 3 to 4. 3 millimeter circular. So the pupils are very round and they're symmetrical with respect to each eye, in the center of each other pupil. Rounded and symmetrical. And now I'm going to be checking the direct light reflex. This is the napkin. So as I'm testing the direct light reflex, please look straight ahead. Okay, so the pupil is constricting and dilating with respect to the light. Okay, perfect. And I'll be checking the consensual. Okay, so the pupils will constrict and dilate with respect to each other with relation to the light, and same with the direct. The pupil will constrict and dilate with relation to the light. So now can you please look straight ahead at my finger? Okay. So pupils are constricting and dilating with respect to the distance, and the eyes are also converging as my finger gets closer to the eye. So per the his pupils equal round and reactive to light with respect to accommodation. And now I'll be looking at his mouth. Looking at the exterior lips, they're a nice pink color. They're not crusting, there's no chapping, so he has good hydration. Looking inside the mouth now. Okay, thank you. The gums are not bleeding, it's a nice pink color. Teeth are all there. No looseness, there is one missing tooth, but everything, the remaining teeth are all intact. Looking at the tongue, there's no signs of muscle atrophy. It's very symmetrical. It's a symmetrical tongue. The hard and soft palate, they're a nice pink color and there's no lesions. Can you please say ah? The uvula is say ah longer. The uvula is midline. And as he says ah, the uvula and soft palate both rise. And without any tremors, it stays midline. Can you please stick your tongue out? As the tongue goes out, it stays midline. It doesn't deviate from left to right. Can you please put your tongue side to side? Okay, there's no tremors. And can you please say light type dynamite?
Light type dynamite.
Okay, so he's able to do these exercises. So hypoglossal nerve, glossopharyngeal, and the vagus nerve is also all intact. I forgot to mention for the eye, cranial nerve for the eye is 3, 4, and 6 are all intact. No, just 3 is intact, but everything is intact. Okay, and I'll be checking at the upper extremity. I'll be checking at the neck now. Looking at the neck, there's no discoloration. There's no visible masses, lesions, or no, nothing like that. I'm going to be palpating the trachea now. Okay, the trachea is midline, not deviating from left to right. The thyroid is not palpable, so the thyroid is not enlarged, which is good. Now I'm going to be doing some exercises again with you. I'm going to put my hand here. Can you please press your face against my hand to resist the pressure?
Sure.
Okay, left. Okay, next one. Okay, and for your shoulders, can you please raise them and I'll try to push them down? Okay. He's able to resist the force of my hand with no problem. The strength is equal bilaterally, so we can say that the spinal nerve is also intact. So now I'll be checking the upper extremities. For the upper extremities over here, there's no signs of muscle atrophy. There's no edema. He has good skin turgor. There's no discoloration. There's even hair distribution. There's no signs of muscle atrophy. Skin turgor, nice color, hair distribution. Nice color. And it's the texture is very small, very soft. And yes, okay. Now I'll be checking the nails. Can I please look in your nails? There's no signs of clubbing here as there is a nail angle. And I'm going to be checking over here now for the capillary refill. One. Okay. Circulation will return to the distal ends of the fingers in less than 2 seconds, so we can say that they have good circulation. And now can you please squeeze my fingers as hard as you can? Okay. The strength of this finger squeeze test is equal bilaterally without any problems. What happened to the phone? Oh, just dying battery. It's okay. I thought it stopped recording. Okay, so he's able to resist. His finger test is equal bilaterally. Can you please stand up? Okay. Go like this with your fingers. Put them down. Fingers down. Stretch fingers. Make a fist. Fingers down. Hands up. In. Out. Okay. Like this. 1, 2. Flip. One more time. Flip. Hands to the side. Up. Down. Hands up. Hands over here. Behind the back. And shrug your shoulders, please. Was there any pain or discomfort or any grinding feeling? Okay, no. Nothing. Have a seat, please. There's no crepitus, there's no pain, there's no discomfort, there's no altered range of motion, so which is all good. I'll be looking at the feet now. There's no signs of muscle atrophy. There's even hair distribution. The temperature is very warm. Even hair distribution. There's no edema. He has good skin turgor. There's no odd discoloration either. And this texture is also very smooth. I'll be checking for the pedal pulses now. This is on camera this time, yeah. Okay, for the pedal pulses. Okay, they're here. The dorsalis pedis, posterior tibialis. Okay. The pulses are nice. They're equal bilaterally. It's kind of a weak pulse because it's cold, so it's 1+, and they're 1+, and they're both, the rhythm is regular. I forgot to check the carotid. I'll do that now actually. Checking at the carotid artery. Again, carotid artery is a much stronger pulse. It's a 2+. They're equal bilaterally. The rhythm is also regular. It's not a bounding pulse. And I'll check also the radial pulse. I forgot to check that as well. For the radial pulse, it's also a much stronger pulse, 2+, bilaterally. They're both equal, symmetrical. They're both symmetrical and equal bilaterally. The rhythm is also regular. Yeah. And now I'll be checking another exercise with the feet. So I'll be putting my hand under your foot. Can you please press down like you're pressing at a gas pedal and try to resist the force of my hand?
Alright.
Okay, put your feet up so you can see in the camera. Okay, 1, 2, 3. Okay, so the strength is equal bilaterally and symmetrically. Okay, one more time. Only go. Can you put your feet up this time?
Mm-hmm.
Okay, 1, 2, 3. Okay. Okay. They're both. The strength is equal symmetrically and bilaterally. They're both. The strength is equal on both sides. I'll be checking the thorax now. Can you please face that way? Okay. Looking at the thorax here, it's a nice contour. It's no abnormal contour. There's no odd discoloration. There's no edema. There's no physical deformities. There's no skeletal deformities. There's no lesions or masses or anything like that. The anterior transverse to posterior ratio is 1:2. He's not barrel chested, and there's no problems with his back. It looks like there's no. It's nice. Okay, so I'll be listening for breath sounds now. Can you please stay that way? Look. Okay, every time you feel the stethoscope on your back, take a deep breath in through your nose and exhale through the mouth slowly, please, okay?
Yeah, okay.
There's 9 levels of for the posterior chest. Starting at the apices at the top, breathe in. It's clear so far, no adventitious breath sounds in the bronchovesicular. There's no adventitious breath sounds. They're clear on the back, no crackles or wheezes. I'll be checking the anterior now. Sit up properly over here. So in the front, there's 5 levels. Again, breathe in through the nose, out through the mouth. No adventitious breath sounds, posterior nor anterior. They're both clear. The breathing is not labored. It's a very nice, it's nice equal breathing sounds. 16 breaths per minute. They're equally spaced out, and it's not labored breathing. I'll be checking for the cardiac sounds now, starting at the aortic valve. So just don't do anything. Just breathe normally now. Aortic valve, midclavicular, right lateral, second intercostal space. Pulmonic valve, midclavicular, left lateral, second intercostal space. Erb's point, third intercostal space. Tricuspid valve, fifth intercostal space. Mitral valve, fifth intercostal space. There are no abnormal heart sounds. Everything is heard and everything is very smooth. Not beating too fast, not beating too slow. It's regular. It's 70 beats per minute, and you can best hear S1 at the base. S1 at the apex at the mitral valve. You can hear S2 best at the base, which is at the pulmonic valve. S1 and S2 is best heard at Erb's point. And now we're going to do abdomen. Right, abdomen. Right, yeah. Okay, please quickly lie down over there. Okay, I'm going to expose the abdomen now. Okay, don't fall asleep yet. We're almost done. Okay, looking at the abdomen, there's no it's a nice contour. It's very flat. It's not protruding. It's not scaphoid. The umbilicus is midline. There's no signs of there's no striae. There's no tumor. There's no edema. The demeanor, he looks very calm as I'm looking at his stomach. There's no signs of pain. He's not guarding. So I'm going to be listening now at the right lower quadrant first. Right lower quadrant. Vowel sounds are present. Kruk, kruk, kruk. Vowel sounds are present. Right upper quadrant. Left upper quadrant. Vowel sounds are present. He just finished eating. Vowel sounds are present in all 4 quadrants, not hyperactive nor hypoactive. Not hyperactive like someone who has diarrhea, or hypoactive like someone who's constipated. I'll be touching it now. Please let me know if there's any pain while I'm touching it. No pain, no tenderness so far. No tenderness or abnormalities. No abnormalities, and he's not guarding as I'm palpating his stomach. Now I'll be checking the bladder as well. Any pain, or do you feel any need to void? No? Okay. Okay, so everything is done. I hope I didn't miss anything. I hope that's it. Okay, thank you. Hopefully this is it.